Check. You're gonna balance it out up here, if you will. You come on in. Close as you feel. Mr. Montgomery? Yeah, come over and balance it out. Thank you, sir. Appreciate you being here. It's August. That's right. Good afternoon. My name is Mike Cooper, Parish President for St. Tammany Parish. I want to thank you all for being here today as we discuss COVID and its future here in St. Tammany Parish. Joining me here in front are medical professionals, St. Tammany Parish Coroner and Chief Medical Officer for St. Tammany Parish, Dr. Charles Preston, Dr. Michael Hill, Vice President of Infection Prevention and Quality at St. Tammany Health System, Dr. Timothy Riddell, Regional Medical Director of Austin and North Shore and Slidell Memorial Hospital, Dr. Jacques Gaillot, Chief Medical Officer of Lakeview Regional Medical Center, Mr. Dwayne Mesh with Acadian Ambulance, and District Attorney for the 22nd Judicial District, Mr. Warren Montgomery. And I see Sandy Badger here, CEO of Slidell Memorial Hospital as well. With the sharp rise in COVID and the Delta variant cases and hospitalizations, it's hard to ignore the impact it's having on our doctors, nurses, medical professionals, and emergency responders. Particularly since the middle of last week, we've had a surge in visits to the ERs and urgent care centers here in St. Tammany. We've had a surge in hospitalizations and those being cared for in our ICUs. Younger patients are infected with COVID. Pediatric wards are overwhelmed in many areas. The Delta variant is spreading rapidly and is highly transmissible. Medical professionals tell me that each infected person is possibly infecting 8 or 9 others on average. And there's an uncertainty on when we will reach the peak of this fourth surge in cases and hospitalizations. We're in a public health crisis, particularly here in St. Tammany, and as your parish president, it's my duty and responsibility to ensure the health, safety, and welfare of our citizens. That's why I've asked, once again, those medical professionals and leaders of our hospitals here in St. Tammany to give us an update and share with you, our citizens, how we all can help. So first I'll call on Dr. Preston, our coroner.
Thank you, Mr. President. I find from time to time I have to remind people that I'm actually a physician as well as an elected official. And I invite anybody to go to stpcoroner.org and look at my 3-year-old resume to see my background in medicine. As a practitioner, as a teacher, as a published author and researcher. I have to tell you that I am very frustrated with the position that we are in. We are at war with the Delta variant, and this is D-Day. It has come down to this critical point where if we don't get enough people vaccinated and enough people don't take personal responsibility to mitigate the spread of virus, again, you don't have to have a crystal ball to know what's happening. You just have to look at last year, but imagine it 100 times worse. From June 15th to July 16th, we had 1 death in St. Tammany Parish. From the 17th until today, we have 24 deaths, except on my way over here, I was notified of the 25th. Those deaths represent a small fraction of people infected with COVID. We don't know what the long-term consequences of COVID are going to be, but we have a pretty good idea. There are many people suffering neurologic effects, COVID brain, potential heart disease, kidney disease. But the most important thing, and I'm sure my colleagues for the community are going to stress this, is we have outstripped the resources of our healthcare system. We are in a dire, emergent situation. The government cannot solve this. Only the actions of individual responsible citizens can stop this plague. There is so much misinformation, and it is very concerning to me. I was told there was a rally today to encourage people not to get vaccinations and not to wear masks. Those people are not interested in the public health of St. Tammany Parish. Those people are interested in promoting a political agenda. And that political agenda makes no sense to me, because the people who are most at risk are the most conservative voters in this parish. We need to use common sense. This is very simple. Wash your hands, wear your mask, get vaccinated, and we may be able to avert a local and national economic disaster that's just going to be answered with another $3 trillion solution that the government doesn't have. So I'm not appealing to the people that think that COVID is somehow tied to immigration. I'm appealing to the people who have common sense, who have children that cannot be vaccinated, that are now our most at-risk population. This is a pandemic beyond imagination, and it is getting worse every day. If individual citizens don't take action immediately, this is going to result in much more dire consequences. I really am concerned and alarmed that things are going to get a lot worse before they get better, and there's only so much that the government can do to bolster society. I am appealing to everybody to please do the little things that are patriotic. Wear your mask, get vaccinations, protect your neighbor. You are your brother's keeper. And it is not just the person who refuses the vaccination that is at risk. It is everybody who comes in contact with that person. So even if you're not concerned about your personal health, please have concern about your neighbor's health. Thank you.
Thank you, Dr. Preston. Dr. Preston and the other medical professionals up here clearly see this on a daily basis and can best illustrate, as Dr. Preston has, the public health crisis that we're in today. And I want to thank you for sharing those words, Dr. Preston. Dr. Michael Hill with St. Tammany Parish Health System. Doctor.
Thank you, President Cooper. I couldn't have said it better, Dr. Preston. I've never seen anything like this before. Our hospitals are being overwhelmed. You don't believe me? Come by the ER. There are lines now around the building because there are no seats available in our waiting area. We have 115 people in the hospital today. We have many more coming. We're admitting 17 to 20 patients a day. There is no room for them. There is absolutely no room. We have 40 people in critical care, 13 on vents, many more almost on vents. As Dr. Preston said, we'll have many more deaths. 87% of the people admitted to St. Tammany Health System are unvaccinated. This is a tragedy. This is a preventable tragedy. We are hit with a tsunami every single day at St. Tammany Health System and throughout the entire parish. Our health system is being overwhelmed, and we have yet to reach the peak of cases. I frankly don't know what else to do. We have surge plans. We have staff working tirelessly, overtime. It's very unfair. It's unfair to them. It's unfair to their families. And again, this was totally avoidable. So what can we do today? Number one, we've got to stop the social gatherings. These big crowds are super spreader events. We have too many unvaccinated people in this parish. Our testing positivity rate at St. Tammany is over 25%. That means you've got a 1 in 4 chance of coming in contact with an infected person in crowds. The second thing we can do is wear masks. It's not a political situation. There are no politics involved in wearing a mask. Do it for yourself. Do it for your family. I want to also stress that vaccinated folks can get sick. I've had a lot of questions about this, but the majority of the folks that have vaccines do not get very sick, and most of them have minor or no illness. However, it's important to prevent the elderly patients who have been vaccinated, who may still be susceptible to severe illness. And as Dr. Preston said, we've got to protect our children. I'm pleading with the public. I'm pleading with my fellow citizens. The only thing we can do is to begin to mitigate this crisis is to wear a mask, get a vaccine, and socially distance. The final message is we are also here to serve the rest of our non-COVID patients. So if you have a true emergency, please go to the emergency room. That's what we're there for. However, if you don't have a true emergency, go to your doctor's office or an urgent care center, because the ERs, all of the emergency rooms, are totally overwhelmed, and you'll have quite a wait if you don't have a major emergency. Thank you very much.
Thank you, Dr. Hill. I might point out, since I've been watching the numbers on a daily basis as well, it's important to know that the 115 patients that Dr. Hill was referring to is out of 180 total census, more or less, if I'm not mistaken. So 115 of the 180 census at St. Tammany Health System are related to COVID patients, a startling number. Dr. Timothy Riddell, Austin North Shore.
President Cooper, thank you for having me today. My name is Timothy Riddell. I'm a physician, the regional medical director at Ochsner Health here on the North Shore and in Slidell. This is a difficult time for all of us. You'll hear the emotion in our voice as we go and work with our staff and our teams and have to give them not just one more patient, 10 more patients, 15 more patients, every single day. Every day we hope that number is going to go down. Every day that number's been going up. We see that number continuing to increase and rise. That rise has been almost 40% since the beginning of this month alone. We've seen those increases occur. We've seen those increases occur not just in the elderly and the infirm, but our average age is 53 years old right now. We don't just see those increases in people who have comorbidities, but we see a positivity rate of 28% in our children. The only way to stop this is freedom. And I've heard a lot about freedom talked about in the last couple of weeks. But this is the freedom to act responsibly. The freedom to make a decision to protect the people you care about and to protect the people around you. This is an opportunity for Louisiana not to be 50th in every health ranking. This is what that feels like. Right now, live time, in person. This is an opportunity for us to get vaccinated, for us to wear masks, for us to distance in a way that helps keep us and all of our fellow citizens safe. Once again, I plead with you to do all of these things, and I thank you for the time today.
Thank you, Dr. Riddell. And now, Dr. Jacques Guillotte, Chief Medical Officer of Lakeview Regional Medical Center. Dr. Guillotte.
Thank you, President Cooper. So I'm Dr. Jacques Guillotte, Chief Medical Officer at Lakeview. I'm trained in internal medicine and pediatrics. I'm up here giving the fourth opinion among these doctors, and you won't find so many times when there's so much agreement. My fourth opinion concurs with everything the other doctors have said. This is a crisis. I think the big message is that this is very real, and we need to focus on what we can do to improve the situation. I want to talk about how much our resources are stretched thin. At Lakeview, we have 38 COVID patients right now. We have a little bit of a smaller census, but that 38 represents well over a third of our acute care patients at this time. And this is almost 1.5 times the peaks that we had, or the number of patients we had in the previous peaks. We have about 2.5 or 3% of our employees out with COVID illness themselves. It's stressful taking care of these patients. You're always worried about the risk of infection. You have the burden of taking the personal protective equipment off and on. You're dealing with patients and their family members that are struggling dealing with this illness. So there's a real burden. The other thing, Dr. Hill talked about taking care of people with non-COVID illness. And to take it a step further, we represent the larger hospitals in the community. A lot of the outlying rural hospitals don't have a cardiac catheterization lab. They don't have medical subspecialists, and they rely on us to take transfers in when patients need a higher level of care. We're not able to accept patients at some of these outlying facilities all across the North Shore, sometimes all across the state, and even across into Mississippi. We've had people with heart attacks that needed treatment, people with strokes at other places that needed treatment, and we just don't have the room to take them in. So it's very real. It's affecting not only a long wait in our emergency room because we're overstaffed, but even hospitals in a wide area around us. So I want everybody to take it very seriously to get vaccinated. I want to remind everyone that vaccination can decrease the chance of getting a COVID infection, but more important than that, it's not 100% effective. If you do get COVID after the vaccine, you're going to have a much greater chance of a milder illness and a chance to avoid a hospitalization. At the same time, the fact that you can still get an infection emphasizes the need for the other measures like wearing a mask and hand hygiene and avoiding the large social gatherings. So I want everybody to do their part and follow all of these infection prevention precautions. And I just want everyone to know that this is very real and we need to take these steps to get past this crisis. Thank you.
Thank you, Dr. Guillotte. Next, I'm calling on Mr. Dwayne Mesh with Acadian Ambulance Service. He's going to give us an update on how COVID is affecting emergency medical providers and ambulance services. Dwayne.
Thank you, President Cooper. Thank you to my colleagues from the healthcare professions here represented today. I don't want to repeat what they've already said, just kind of bring some realism to the room. Our transports, not only here in St. Tammany Parish, but across the state. We service some 35 parishes throughout the state of Louisiana. Also represented in Mississippi. We have several counties that we operate there. And as well as there, we're in the Texas market. And it's not isolated to just St. Tammany Parish or just Louisiana. This is a huge pandemic and one that we've definitely seen this uptick in patient transports over the last several weeks, as everyone has said. We attribute a lot of that to the lack of interest to become vaccinated. Everyone has a choice, but we just ask that you strongly consider getting vaccinated to help curb this pandemic and try to get us back on track. As a healthcare professional, we are challenged with keeping up the pace. Many of our folks in the EMS industry are just tired. We've worked hours across hours, days upon days. We continue to have increases in our transports. Here in St. Tammany Parish alone, we are experiencing about 20% increase on patients transported. Now that is different than the numbers of calls. As my colleagues have said, there are many cases where we can't get them into the hospital. There are no beds in the hospital. Please realize that. Understand that if you do not have business, please stay at home. We're encouraging you to stay at home, stay out of the public. When you have to go in public, please use your mask. And if you have to be in your home and you have people that have to come to visit you, make sure that if you're in that situation, you are socially distancing and you're avoiding all contacts. I can't say enough about the importance of sanitizing your hands, washing your hands constantly, keeping them out of your face. There are many things you touch in a day that you do not realize someone who was infected moments before you were there has touched that. And that's how this carries and this pandemic continues to grow. As I said, our calls are even more than the 20% I talked about. I'm also involved with the LDH, the Department of Health and Hospitals here in the state. I am one of the regional resources during events such as this pandemic. So we have a conglomerate of folks who meet regularly. And again, this is statewide. It's not isolated to just the North Shore or just St. Tammany Parish. Hospitals are full. A lot of the calls we go to, we're having to refer that patient to call their physician if their cases are not one that is of dire emergent need to go to a hospital. We encourage them to call their physicians. Some of these patients we're taking to alternative destinations, such as urgent care centers and behavioral health units, where we're going directly to them. We're following the Centers for Medicare and Medicaid Services, CMS guidelines, in doing so. Some of these patients we're treating in place, following those same guidelines through CMS, and we're trying to keep as many patients as we can that really don't need the hospital out of the hospitals, so that we do have the ability to treat those that seriously need the hospital and need those admissions. Many of the hospitals, as you may not know, are not doing routine surgeries as they normally would. They have had to discontinue that practice in order to try to keep the beds open for all the critically injured patients, critically ill patients, and those who are COVID-related patients. Just some things I want to mention is that you remain home. And again, if you don't need to travel, please stay in your home. Avoid personal contact. Limit those distances to 6 feet or greater. And you should always mask up. Even though you've had the vaccination, you still can get COVID, but please understand that the science is showing that many of the cases where people have been vaccinated and are getting COVID, their outcomes are much better than those who have not received the vaccines. Some people are telling us that they're afraid of the position that they're put in when they have to take a vaccine, and I understand that. But if you're not certain, please call your doctor's office. Speak to your doctor. Let him look at your case. There are some cases where that may be true. But in most cases, the vaccine is definitely the route that you want to go. So keep your hands away from your face. Practice distancing whenever possible. And stay safe. Thank you.
Thank you, Dwayne. Thank you, Dwayne. Appreciate that. Mr. Montgomery, District Attorney, 22nd Judicial District.
Thank you, President Cooper. My name is Warren Montgomery. I'm the District Attorney for Washington and St. Tammany parishes. And I come to you today not as a physician or someone skilled in the medical field. I come to you just as you are, an average citizen, observing all this, all that's transpired. And one thing that all of us can agree upon is that these individuals, these men in the medical field, are not part of some vast political conspiracy. They're all telling you what they know based on their experience, their knowledge, their expertise, and that is that we're in a crisis. I know that many of you, like me, had hoped that all this would have passed and that by this time, back to school, that we wouldn't have to be wearing masks, that maybe we wouldn't even have to be worried about vaccines. But things have changed. Dr. Preston mentioned a month ago, 1 person dead from COVID. The last 30 days, 25. That's a dramatic increase. And all these medical professionals referred to the fact that not only are people dying from COVID, but it's being pushed out into other lack of operations, medical care, other people who are dying as a result of our inability to handle the COVID situation. So this crisis is impacting not just people with COVID, it's impacting other people with health issues, it's impacting the court systems. We can't have trials. Therefore, we can't hold people accountable. Therefore, people are committing crimes because they're out on the street and there's no accountability. This is now a do-or-die moment, ladies and gentlemen, for us as a community. It requires all of our efforts, all of our focus, and I urge you to get vaccinated, follow all the other prescriptions if they're recommended, wear a mask. That's very, very important for our community, and I say that simply as someone like you. Look, this is not all made up. This is reality, and it's happening to us and our community, and we've got to take responsibility and do everything we can to stop it. Thank you so much, and God bless.
I know my glasses are here. They're right here. Thank you all for providing your insight, your professional insight. I ask our citizens to please take all precautions that are offered to protect themselves, their families, and those that they work with. We're doing everything that we can to mitigate the spread of the virus. As of today, we have 49% of St. Tammany Parish residents who have taken the first dose of the vaccination. This evening, Dr. Gina Lagarde, who is the Regional Administrative Medical Director for the Office of Public Health, is holding the North Shore COVID-19 Teletown Hall meeting. She'll be hosting this informative call where COVID issues related to hospitalizations, pediatrics, and pregnancy fertility will be discussed by a panel of 3. The public is encouraged to call in at 6:15 p.m. to participate. That number is 855-756-7520. 855-756-7520, extension 75212, pound. Press pound. Please, let's do what we need to do to avoid cancellation of events and activities that support so many great causes. Let's do what we need to do to support and sustain our local businesses. And please, let's do what we need to do to save lives. I thank you. I'll open it up for questions for myself or any of the professionals that we have here.
So a question for everyone on the hospital systems in the area. We're seeing a few other systems in Louisiana now mandating vaccines for their employees. Obviously, a lot of medical workers, doctors, nurses included, have not gotten the vaccine. Is there any sort of timeline on when that would be mandated in each of the services?
I'm going to answer on behalf of St. Tammany Parish government. We are certainly hoping that we don't have to get to a requirement for asking our employees to get vaccinated. We're hoping, because of the plea that you've heard here from our chief medical officers and health professionals, that people will indeed heed the call for getting the vaccination.
I can just speak for St. Tammany Health System. We are strongly encouraging our employees at this point to get a vaccine. I think that that's the most important thing to do. Right now, almost 100% of our physicians are vaccinated and their families. We're doing better in some other areas and not as good as we should. But what we're trying to do is encourage everybody right now to get a vaccine. I think once the emergency use authorization goes away, we may have other discussions, but at this point, we don't have any definitive plans to mandate a vaccine. Thank you.
This question is for any of the
And who are you with, sir?
WWO.
Okay.
This is a question for any of the doctors. Can you just speak of maybe your frustration that no matter how many medical professionals you bring up here, how many doctors, how many experts, that just there's a group of people in the population that are just not going to get vaccinated. Can y'all speak about that?
I'll take the boiling over with frustration. So yeah, it is very frustrating to be in a position where all of us have dedicated our lives to preventing harm, to preventing illness and death. And despite that, the proliferation of very sophisticated misinformation is convincing people not to use common sense, not to rely on CDC.com, JohnsHopkins.com, the Mayo Clinic. There are so many reliable sources of information, and instead they're turning to clearly sources with political agendas trying to make this some kind of civil rights issue. This is not a civil rights issue. This is a worldwide health crisis. And it is very frustrating that our medical system is on the verge of collapse because of the success of these very sophisticated misinformation sources that encourages people to ignore the advice of medical professionals and doctors. And so that's why I'm reaching out to influencers in the churches, in business, as many people as I can. And I will tell you, probably the most persuasive influencers are those who have had COVID or have had a loved one who have had COVID. And they see the suffering in their families, and they're calling me up and asking me just how fast they can get a vaccine and where they can get it. And I welcome those calls because those people, unfortunately, are learning the lesson the hard way, but that message is slowly trickling out. And again, don't trust any of us. Trust your doctor. If you can't trust your doctor, why is he or she your doctor? So please, reach out, find reliable information from multiple different sources, but beware of anything that is funded by a political agenda, because that is truly dangerous and it is going to result in significant injury and significant death.
You were talking about maybe the possibility of having to cancel events in the past, and we were talking before about them being super spreader events. Has the discussion come up in St. Tammany Parish government on whether to cancel events, or is there a point that you guys are looking to make that decision?
We have no plans at this time. We're hoping that those who may be planning such events, if it is in fact a super spreader, where it brings people, whether it be inside and or outside, that the organizers consider making those decisions right now. I'd venture to say that in the next week, if not sooner, because we know the numbers continue to go up, the hospitalizations continue to go up. As we've said before, we have not reached that peak. That it will have to be done. But at this point, we're seeing it. We're seeing businesses and organizations curtailing their plans for big events. And so we'll continue to monitor that. Thank you, Jennifer.
Just to clarify, the mask mandate that you put out last week, was there anything different from the governor's mandate you saw earlier, and were you expecting that backlash after you put out?
To answer the question, the executive order that was put out last week mirrored the governor's mask mandate, and it was the same executive order that we've used since the beginning of this pandemic. The executive order has been in place the entire time, and even before that, the same executive order template has been used. So there was nothing different, but somebody happened to call out a specific paragraph that had been there all along and made issue about it rather than the seriousness that we have about COVID in our community right now. But it was the same language, nothing different. Thank you.
Of course, nobody wants to go back to a lockdown, but as COVID continues to surge, the numbers aren't flatlining. Do you think that the governor should pull the trigger and order the stay-at-home order again?
I don't know what the governor's going to do. I know that businesses and corporate offices are reviewing their work plan now. We're doing it here at St. Tammany Parish Government, not as a requirement, but we're looking at what if cases continue to rise. People are calling in sick or quarantining because they've been in contact with somebody every day. So we are preparing for that now. The governor has asked businesses to look at perhaps working remotely if possible. So I think businesses are doing that at this time. We're setting up our, reestablishing our laptops for work at home purposes. So I think that's happening even before any requirements come from government.
I do have a question for the doctors. If y'all can maybe explain the additional testing that goes into it to determine whether it's the Delta variant or what variant, like how do y'all determine that?
So as you might imagine, it would be impossible to test every single sample that comes through for the different variants that are out there. So a certain subset of those samples are sent to the state lab to be tested for that to identify. At this point, there are no other variants. The Delta variant is the one that is causing not just the large majority, but almost entirely every single case that we're seeing. But that's how the testing is done.
Thank you.
This one's again for the doctors. So there's been quite a loud backlash over masking in schools. Could you guys speak to the benefits? Some people brought up, the surgical masks don't do as much as we would hope. Could you speak to your opinions on having the mask mandate apply to school children?
I think that went to the infectious disease doctor. Touchy subject, but surgical masks do work. Obviously, an N95 mask like Dr. Preston has on would work better, but they're hard to breathe through. So this is probably as good as it gets, particularly in school kids and running around in the heat and everything else. We do know that this is a respiratory virus, that it is spread by respiratory secretions, by secretions that sometimes fall on surfaces and then get touched. So it's going to be very, very important to try to reduce the secretions that hit the air, the droplets. And the only way to do that is to either get away from people, which you cannot do in a classroom, although they try the best they can, or put a mask on. Now, I know that's controversial, but the science has proven that when we were all wearing masks and kids weren't together, we had no RSV. Respiratory syncytial virus is taken off because kids took off the mask. And look, I think there are times when maybe we have low prevalence of COVID in the community, we can rethink the mask requirement. But when we're in a major crisis when very many people are running around with COVID, asymptomatic and symptomatic, we've got to take mitigation, and one of the mitigations is wearing a mask. So I think the best you can do, is it perfect? No. But I think from a public health standpoint, it's better to have masks in school right now than not.
Again, I want to thank everyone for coming, our doctors and others for your time, the time that you've taken out of your day to come and give insight on this very important matter. And I want to thank our local media for covering this. This is important to us, and we're happy to keep you updated as things progress. Thank you all so very much. Thank you all.